Hi my beauties. Okay, so today's topic is the aging face and facial changes that happen with time over age as we get older and have birthdays, different changes that happen, and how we can help reverse these changes or minimize the effect of these changes. And so the reason why I wanted to pick this topic is because a lot of you guys have asked me in my comment section, on my YouTube channel, on my DMs, on my Instagram account, and just patients that I see every day in clinic, why is this happening? Why is this happening so fast? Why wasn't this happening before? How do I fix it? How do I slow it down? I still want to look like myself. I don't want to look weird. I'm getting freaked out by seeing my other friends and family members who are getting procedures and not looking like themselves anymore. So there is a reason for that. And I feel like education is everything, right? That's why I have this YouTube channel. And if I can educate you guys to perceive changes that you see in yourself or in your friends or in your loved ones that are happening decade over decade, and to kind of give you an internal perspective from a cosmetic dermatologist point of view, or how a plastic surgeon would review these changes and kind of know what treatments and what procedures would be best for you based upon these changes. I think when you have that insight, as opposed to just looking in the mirror and saying, okay, I'm getting marionette lines, I'm getting nasolabial folds, I'm getting tear troughs, my face is sagging, I have all this laxity here that I didn't have before, why is this happening, how do I reverse it, how do I stop it but still look like myself? So it's really interesting, and it's a concept that we learn in advanced medical training, like in fellowship, after we completed residency, after we completed board certification. So this comes from about 20 years of experience knowing the face, studying facial anatomy, and studying the skin and the changes that happen over time, and how to kind of minimize them, slow them down, and reverse them while still looking like just the well-rested best version of yourself, but not looking any different. So starting with the most minimal changes, but changes that start to happen even in our late 20s, they progress in our 30s, they become a little bit more apparent in our 40s, and then they start accelerating in our 50s, 60s, 70s, and beyond. One of the first things that happens is we start to get a loss of collagen. So when we're younger, when we're adolescents, when we're in our teenage years and in our early 20s, our cells are renewing themselves and our fibroblasts are producing a lot of extracellular matrix proteins, which are collagen, elastin, and those glycoproteins that help give skin its turgor, its structure, its bounce, and its kind of the smooth, plump look that we have to the skin. And so every year we lose collagen and we lose elastin. That could be accelerated by certain extrinsic factors like UV light, HEV light from our devices, unhealthy lifestyle habits, not eating clean, environmental pollutants, and just things that happen intrinsically and extrinsically to break down collagen and elastin, and we're not producing it as rapidly and as vehemently as we were when we were younger. So you're losing it at a more rapid rate than you're making it. So that's the first thing that happens, and this is sad but true, guys. I'm going through this with you, but I want to be able to educate you guys on what's going on as we age. So we lose about 10% of our collagen each decade, and collagen and elastin gives us that elasticity to our skin that keeps everything nice and snatched and tight and smooth and firm. And so when we're losing 10% of collagen each decade, we start to get facial laxity, we start to get jowls, we start to get nasolabial folds, and we start to get kind of wrinkled laxity in our necks and our chests and other areas of our body too. But there's certain things that we can do over time, using good medical grade skincare products that help stimulate your cells to make collagen and elastin at a more accelerated rate than it would otherwise. Things like laser resurfacing, energy-based devices, a lot of non-surgical treatments to stimulate your skin cells and your fibroblasts to make collagen and elastin, because as time goes on, they get lazy and they get, kind of lackadaisical and zombie-like, and they stop producing all these extracellular matrix proteins. So stimulating them to do so can help with keeping the skin nice and firm and tight and help smooth out fine lines and wrinkles. So that's the first thing that happens, and that has everything to do with the extracellular matrix proteins, collagen and elastin. So another thing that happens, in addition to loss of collagen and elastin, thinning of the epidermis, thinning of the dermis, right underneath the dermis you have the subcutaneous fat. So there's fat pads that lay underneath the skin, and they thin out and separate over time. So what happens is, where you had two fat pads kind of connecting, they start to retract back, and there can be a little depression or a little what we call festoon. For example, in the mid-face and the cheek right here, when people start to get those little festoons, it's just the fat pad separating underneath the skin. It happens in the tear troughs too. Usually in younger patients, you'll have a smooth eyelid cheek junction, but as the fat pads kind of retract, thin out, and separate, you start to get under eye hollows, or what we call tear troughs, that can kind of give a hill, valley, hill, what we call in dermatology, a little topography or a little depression in that area, to where it used to be a smooth a smooth transition and a smooth contour before, there's now a little like depressed linear area there. And it can happen in different areas of the face. It all depends on your anatomy and what aging process you're in life. And some people have certain changes with age that other people do not. So sometimes patients won't have any tear troughs at all, but they'll have more jowls, or they'll have jowls but no tear troughs, or they'll have nasolabial folds and marionette lines and tear troughs. But these are the changes that happen underneath the skin as that subcutaneous fat thins. Now, there are things that we can do to restore that and to smooth out those junctions. There's dermal fillers, there's all kinds of fillers. There are subcutaneous fat transfers that plastic surgeons do. Sometimes just tightening the skin on top will help give a very natural result and kind of just stimulate your body's own regenerative processes to kind of fill in those voids and smooth out the contour. There's lots of different things we can do, but understanding, okay, why do I have that little line there that wasn't there before? Or why do I have these marionette lines that weren't there last year when I looked through my camera roll? These are the changes that happen with age, and these are the aging facial changes that we can use to kind of fine tune and tweak little things as each year and each decade go on to kind of not reverse it but slow down the aging process. And the last but not least phenomenon that we can see happening in the aging face is that there's bone resorption. Now, this doesn't usually happen until after the age of 50, but if you look at the skull, and I remember in medical school looking at the anatomy of the skull in each decade of life, you start to get bone resorption. So what does that mean? So you'll have mandibular, which is your jawline, or malar cheek bone resorption. So you have to remember your bones and your subcutaneous tissue underneath the skin is kind of like the table, and the skin on top is the tablecloth. As the table starts to thin out, or it starts to get resorbed or disintegrate or thin out over time, that the skin doesn't have that structural support holding it up that it used to. So sometimes dermal fillers can be used to kind of build that back up. For example, the jawline. We do a lot of jawline contouring using dermal fillers because you're replacing that structural support that has been lost to kind of buttress that skin and to kind of hold it snatched tight. As the bone starts to resorb, you start to get some laxity or loss of definition of the jawline. You start to get the pre-jowl sulcus and those little jowl formations that happen. You might get some loose skin here. And so doing a little bit of filler to kind of provide that structural support has shown that it can really enhance that jawline definition, snatch that skin up, and give a very smoothing and tightening effect without looking overdone. Now, the problem is that there's a lot of non-expert injectors that are doing way too much filler, way too fast, and they're doing the same cookie cutter thing on everyone. Now, every face is different depending on your cultural background, your anatomy, your age, and what type of aging process your face is undergoing. And so little tricks along the way and little fine tunes along the way is my approach as a dermatologist. And if you're a patient of mine, we never do too much too fast. But the goal is to preserve the way you look for 30 to 40 years. I mean, if you look at, J-Lo, or if you look at Gwen Stefani, they don't look different, but they look really good and have kind of looked the same for the last 20 to 30 years. And that's because they never let the pendulum swing one way or the other too much. You just do little tweaks along the way to stay looking natural. But the time you start to say, I have this little tear trough here that wasn't there before, let's just do a tiny little bit of filler or correction there before it gets worse. And just staying on top of it over time will allow you to look natural and your best at every decade without looking overdone. So this video is pretty much dedicated to changing of the aging face, which I got a lot of questions and comments asking me to talk about this topic. As depressing as it is, it's actually not very depressing knowing that there's some things that we can do to kind of slow it down or to kind of like make little tweaks along the way to adjust for minimal changes that happen over time. And so that's my approach, and it's not necessarily a sad thing, it's just one of life's realities. But I also want to take this time to note that sometimes, even with my younger patients, if anatomically they weren't given a strong jawline or a strong chin, or they may have inherent and anatomical tear troughs where that's just their anatomy, we can correct these changes in the same way to enhance the way someone looks without changing the way that their appearance looks. So that's the really key important thing with cosmetic dermatology and aesthetics. You want to look like the best version of yourself, not different. And when it's done incorrectly, people won't look like themselves and their friends won't recognize them, or they'll actually be, younger and look older than they are and look overdone, or they'll just not look like themselves. And that's never the goal. And the way to avoid that is slow and steady wins the race. Being conservative is everything, and little changes make big results over time. And keep in mind, fillers aren't always the answer. I think that injectables are, what is seen the most probably on social media, but I'm a big believer in lasers and tightening devices because it's basically enhancing your skin's own regenerative processes to fix the problem. So as the skin thins, you do a little laser resurfacing and Fraxel, and it stimulates collagen and elastin, which helps smooth out the texture and smooths out contour and erases fine lines and wrinkles. Energy-based devices like Thermage or even Ultherapy or Thermatite, there's so many of them out there these days, are going to stimulate a deeper stimulation of collagen to help keep the jawline nice and smooth and tight, help keep the skin lifted with a natural result, because you're basically inducing your body to do the work, and that always gives the most beautiful, most natural looking results. And of course, using good skincare products. My recent line, MD Air with my NMF hydrator, I packed that full of anti-aging polypeptides to help smooth the skin from within at a cellular level, stimulate collagen and elastin to shrink the anchoring fibrils to give a smooth, plumping contour to the skin. So different things like using good medical grade products, protecting your skin from environmental factors and ultraviolet light and HEV light from our devices that can break down collagen and elastin, and doing little lasers along the way. Instead of letting your skin just not be treated and kind of ignoring it and neglecting it, and then at an older age trying to reverse it, start at a younger age if you can. And it's never too late to start. Just doing little laser resurfacing treatments along the way is like working out for your skin, and it'll give you the best long-lasting, most natural results long term. Now there's also other things that are a little bit more aggressive. You could take it up a notch and think about thread lifts, which work really well. It's highly operator dependent, but when they're done correctly and in the correct dermal plane, I perform thread lifts a lot in my office, and people have really beautiful natural results. And these are people who don't want to have surgery, but they want to have a little lift, either a brow lift or neck lift or lower face lift with beautiful results. So there's different things that you can do that are non-surgical along the way to address it. And it's not just about fillers or injectables. A lot of it has to do with lasers or tightening devices, PDO threads, and other non-surgical treatments for rejuvenation. I hope this helps, and I hope that this addressed your concerns, but I just wanted you to understand the changings that happen with age and the aging face, because people always say, well, I have to keep doing filler, but the aging process is a continuous process, and it continuously needs to be tweaked here and there, and there's safe and effective ways to do it. And without having to do too much, the face is going to continue to age, and so doing treatments along the way, you're just changing with it and keeping up. So I hope this helps you. So I hope you found this video useful. Be sure to subscribe and hit the bell so you receive notifications when I try to post an educational video once a week on something in dermatology and aesthetics. So be sure to subscribe and hit the bell so you receive notifications as I post one educational video each week, and I do a live Q&A session on my YouTube channel just for you so I can answer all the questions that you have. I'll be your personal on-call dermatologist always. I love you guys.